Meet Sarah, a 68-year-old from Phoenix who thought her persistent leg itching was just dry skin. I almost ignored it, she tells us, until my doctor discovered it was an early sign of diabetes. Like Sarah, millions of American seniors experience mysterious itching that could signal serious health conditions. Recent studies from the National Institute on Aging show that 60% of adults over 65 develop chronic skin conditions, many of which are warning signs of underlying health issues. Today we'll explore 4 critical areas where itching shouldn't be ignored, backed by the latest research from America's top medical institutions. This information could be life-changing for you or your loved ones. Before we dive in, share your city in the comments below. We'd love to know where our Golden Heart community members are from. Don't forget to like and subscribe for more senior health insights. Now let's start with the most crucial area, your legs and feet. 1. Legs and feet. Critical warning signs you shouldn't ignore. When it comes to itching in seniors, the legs and feet deserve our immediate attention. Dr. Jennifer Martinez, a vascular specialist at Mayo Clinic, shares a compelling insight from her years of experience. What many dismiss as simple dry skin often serves as our body's early warning system. Consider the story of Richard, a 72-year-old retired teacher from Boston. His evening walks became increasingly uncomfortable due to persistent itching in his legs. Like many seniors, he initially attributed it to dry winter air. However, this seemingly minor discomfort led to a crucial discovery during his routine checkup: early signs of peripheral artery disease. The American Diabetes Association reports that nearly 27% of Americans over 65 have diabetes, and persistent itching in the legs and feet often serves as an early indicator. Think of your legs and feet as the foundation of your body's highway system. When something goes wrong here, it frequently signals broader health concerns. Poor circulation affects up to 30% of seniors, according to recent Medicare data. The signs often begin subtly: a persistent itch accompanied by cold feet, skin that looks unusually shiny, or a sensation of tightness. These symptoms might seem minor, but they're your body's way of requesting attention. Medicare covers various treatments for circulation-related conditions, including specialized medications and physical therapy, making early intervention both accessible and affordable. Diabetic neuropathy presents another crucial concern. Dr. Robert Chen from the American Diabetes Association emphasizes how this condition often announces itself through nighttime itching, accompanied by burning sensations and increasingly sensitive skin. Most insurance plans, including Medicare Part B, cover diabetic screenings and necessary treatments, making regular monitoring accessible to most seniors. The American Heart Association brings attention to an even more serious condition: deep vein thrombosis, DVT. When leg itching appears alongside warmth in one specific area or unusual swelling, it demands immediate medical attention. This condition, while serious, responds well to early treatment, which Medicare covers under Parts A and B. Managing these symptoms begins with simple yet effective steps. Start by keeping track of when the itching occurs and what seems to trigger it. Proper foot hygiene plays a crucial role. Daily washing and thorough drying can prevent many complications. The American Academy of Dermatology recommends using fragrance-free moisturizers, while cotton socks and breathable shoes help maintain healthy circulation. Martha's story from Cleveland perfectly illustrates the importance of taking action. "I used to think my itchy legs were just part of getting older," she shares. "My daughter finally convinced me to see a doctor, and that visit revealed early-stage peripheral artery disease. Thanks to early detection, I'm now managing it successfully with medication and lifestyle changes." Don't wait to seek medical attention if your itching persists for more than 2 weeks, especially when accompanied by swelling, pain, or skin changes. Most senior health insurance plans, including Medicare, cover evaluations for these conditions. Your healthcare provider can guide you through the available treatment options and help you understand your coverage. As we move from discussing legs and feet, let's turn our attention to another area that often signals hidden health concerns: your back. While many seniors focus on their lower extremities, the stories I'm about to share about back itching might surprise you. One particular case from a retirement community in Florida recently caught medical professionals' attention, demonstrating how back itching led to a life-saving diagnosis. 2. Back hidden messages. Your skin is sending the story of Eleanor, a vibrant 75-year-old grandmother from Denver, opens our eyes to how back itching can be more than just an annoyance. I kept asking my granddaughter to scratch my back, Eleanor recalls. It wasn't until my doctor noticed the pattern of itching that we discovered my kidneys weren't functioning properly. Recent studies from the National Institutes of Health reveal that persistent back itching affects nearly 25% of seniors, yet it's frequently overlooked as a potential indicator of internal health issues. Dr. Michael Thompson, a nephrologist at Johns Hopkins, explains that our skin often serves as a window to our internal organs' health, particularly when it comes to the back area. Kidney function plays a crucial role in this connection. When your kidneys struggle to filter waste properly, these toxins can accumulate in your bloodstream, often manifesting as persistent itching across your back. The American Kidney Foundation reports that early detection through symptoms like persistent itching can lead to better outcomes, with treatment costs often covered by Medicare Part B. Liver health also demonstrates a fascinating connection to back itching. Dr. Sarah Anderson, a hepatologist at Mayo Clinic, shares how bile salt accumulation due to liver problems often causes itching in the upper back area. This symptom, known medically as pruritus, frequently appears before other more obvious signs of liver dysfunction. Medicare coverage for liver function tests makes regular screening accessible for most seniors. Beyond organ function, nervous system disorders can trigger back itching. Take Thomas, a 70-year-old from Seattle, whose persistent back itching led to the discovery of shingles in its early stages. "I thought it was just dry skin," he shares, "but my doctor recognized it as an early warning sign. Thanks to quick treatment, I avoided the worst complications." The American Academy of Dermatology emphasizes the importance of moisturizing aging skin, but they also warn about assuming all back itching stems from dry skin. When accompanied by other symptoms like fatigue, changes in urination, or yellowing skin, it's crucial to seek medical evaluation. Most Medicare Advantage plans cover specialist visits, making it easier to access expert care when needed. Managing back itching starts with gentle, fragrance-free moisturizers recommended by dermatologists. However, Dr. Thompson stresses that while topical treatments might provide temporary relief, addressing the underlying cause remains essential. Medicare often covers both diagnostic tests and treatments for conditions causing persistent itching. For seniors experiencing back itching, keeping a simple symptom diary can help healthcare providers identify patterns. Note when the itching occurs, its intensity, and any accompanying symptoms. This information proves invaluable during medical consultations, potentially leading to faster diagnosis and more effective treatment plans. As we transition to our next area of concern, let's move upward to discuss an often overlooked zone that can reveal surprising health insights: your scalp. The connection between scalp itching and certain autoimmune conditions might surprise you, as demonstrated by a remarkable case from a research study at the University of Michigan. 3. Scalp, more than just dandruff. Let me share a remarkable story from Barbara, an active 68-year-old from Minneapolis. "I kept blaming my itchy scalp on my shampoo," she tells us. "I switched brands countless times before discovering it was actually my body signaling an autoimmune condition." Now that I'm receiving proper treatment, both the itching and my other symptoms have improved dramatically. The American Academy of Dermatology reports that scalp conditions affect over 40% of seniors, yet many dismiss these symptoms as merely cosmetic concerns. Dr. Rachel Goldman, a leading dermatologist at Stanford Medical Center, explains that our scalp serves as a unique barometer for our overall health, particularly our immune system's function. Recent research from the National Institutes of Health has uncovered fascinating connections between scalp itching and systemic health issues. When your immune system sends out distress signals, your scalp often responds first. Conditions like psoriasis, which affects nearly 15% of seniors according to Medicare data, frequently begin with persistent scalp itching before showing more visible signs. Stress-related conditions present another crucial aspect of scalp health. Dr. Goldman's recent study revealed that chronic stress doesn't just cause gray hair, it can trigger an inflammatory response that manifests as persistent scalp itching. This connection becomes particularly relevant for seniors managing life changes or health challenges. Consider James, a 73-year-old retired professor from Portland, whose scalp itching led to an unexpected diagnosis. During my regular checkup, I mentioned my itchy scalp almost as an afterthought, he shares. That simple complaint led to blood work showing significant nutritional deficiencies. Who would have thought my scalp was trying to tell me about my vitamin B12 levels? Medicare coverage for dermatological consultations and related blood work makes investigating these symptoms more accessible. Many seniors don't realize that their Medicare Part B benefits often cover not just the diagnosis, but also the treatment of underlying conditions causing scalp discomfort. The key lies in recognizing when scalp itching warrants medical attention. While occasional itching might indeed be due to dry skin or regular dandruff, persistent symptoms, especially when accompanied by redness, scaling, or changes in sleep patterns, deserve professional evaluation. As we move forward in our exploration of telling itchy areas, let's turn our attention to a region that often signals circulatory and systemic health issues: your arms. The story of a retired nurse from Chicago demonstrates how paying attention to arm itching potentially saved her from a serious cardiovascular event. 4. Arms, your body's early warning. Meet Patricia, a 71-year-old retired nurse from Chicago, whose story perfectly illustrates why we shouldn't ignore arm itching. My arms started itching intensely, especially at night, she recalls. As a former nurse, I knew something wasn't right. That instinct led to discovering a significant circulation problem that needed immediate attention. The American Heart Association has recently highlighted the connection between arm itching and cardiovascular health, particularly in seniors. Dr. David Chen, a cardiovascular specialist at Northwestern Memorial Hospital, explains that our arms often serve as early indicators of circulation issues. The skin on our arms contains numerous blood vessels close to the surface, he notes. When something's amiss with circulation, this area often signals the problem before other symptoms appear. Recent studies from the Mayo Clinic reveal that approximately 30% of seniors experience arm itching related to circulation problems. However, many dismiss these symptoms as simple dry skin or allergies. What makes this particularly concerning is that arm itching can indicate conditions ranging from peripheral artery disease to more serious cardiovascular issues. Consider the experience of Robert, an active 76-year-old from Seattle. His persistent arm itching, particularly on his left side, initially seemed minor. I kept applying lotion, thinking it was just dry skin, he shares. But when I mentioned it during my checkup, my doctor immediately ordered additional tests. Those tests revealed early signs of cardiovascular disease that we could address before it became serious. Medicare coverage plays a crucial role in addressing these concerns. Under Medicare Part B, seniors can access various diagnostic tests, and treatments related to circulation problems. Many Medicare Advantage plans also cover specialized treatments and medications needed to address underlying conditions causing arm itching. The key lies in recognizing when arm itching requires medical attention. While occasional itching might indeed result from environmental factors, persistent symptoms, especially when accompanied by numbness, tingling, or temperature changes in the arms, warrant professional evaluation. Dr. Chen emphasizes that early intervention often leads to better outcomes and simpler treatment options. As we conclude our exploration of these crucial body areas, let's focus on how to put this knowledge into action. Understanding these warning signs is just the first step. Knowing when and how to respond can make all the difference in maintaining your health and independence. Throughout our journey exploring these 4 critical areas, legs and feet, back, scalp, and arms, we've seen how seemingly simple itching can signal important health messages. Remember Sarah from our opening story? Today she's successfully managing her diabetes, thanks to paying attention to those early warning signs. Your body speaks to you daily through these signals. Don't wait like Martha did, letting symptoms persist until they become serious. Take action by scheduling your annual wellness visit, covered by Medicare, keeping a symptom diary, discussing any persistent itching with your healthcare provider. Share your thoughts and experiences in the comments below. Has this information helped you recognize any important signals from your body? Don't forget to subscribe to Golden Heart Advice for more senior health insights that could make a difference in your life or someone you love. Remember, staying informed and proactive about your health isn't just about living longer, it's about living better. Until next time, take care of yourself and keep listening to what your body is telling you. For more senior health tips and advice, click the notification bell to stay updated with our weekly videos. Your health journey matters to us.